Welcome back. Let's turn now to the latest in the coronavirus pandemic, as many Americans are ditching their masks after the latest CDC guidance says vaccinated adults can now go maskless both in and outdoors. We're joined now by Dr. Rishi Desai, Chief Medical Officer at Osmosis and a former Center for Disease Control and Prevention Epidemic Intelligence Officer. Dr. Desai, it's always great to have you here with us. I want to ask you about that CDC guidance. There's been so much talk about it after. Was that the right guidance to make at this time? It seems now that the onus on mask wearing lies with a lot of businesses, frankly, and relies a little bit on the honor system of the people that are frequenting them. So was this the right time to make that move?
It's a really good question, and I think that a lot of the decisions made by the CDC are coming under a ton of scrutiny because obviously over the last year and a half, public health has become this thing that we all kind of talk about over the kitchen table. We never used to do that. And so this decision comes in the context of a falling number of cases. We have fewer cases than we've had in roughly 11 months, a rising number of folks that are getting immunized, more and more immunizations on the order of a couple million per day. And we also have seen that the vaccines are effective against the variants that they've looked at. And so these are the kind of data points the CDC was looking at. They were saying, look, every day we have more immunized, falling cases. Hospitals are right now able to kind of manage the cases that they do see. We weren't seeing the atrocities as we were in the early days in New York, in Los Angeles, in Florida, and other places. So overall, at some point, this call had to be made. They had to make a call to say, look, you don't have to wear masks anymore because we think the threat level is low enough and that we think it's going to sustain at a low level. And then the other kind of big thing is that we just expanded vaccines to children 12 to 15. And so there's another group that's going to be eligible for vaccination. All these things combined, and they made that call to pull the mandate. Do I think it was reasonable? Totally reasonable. Do I think that people are going to disagree, whether it should have been 3 weeks earlier, 3 weeks later, all that kind of stuff? Absolutely. People have a right to disagree with that. And I know a lot of public health folks, a lot of really smart public health folks are upset because it came a little too early or it wasn't communicated in the right way and whatnot. And all of that aside, my personal belief is that it was a very reasonable move and a move that we should get behind because I think that the CDC, and more than ever, needs our trust and support, and we can lend it by saying, hey, let's get on board with this and move forward.
Doctor, I don't know if you saw this week, Hospitality Industry Association came out and said, in light of the CDC guidance regarding masks, you don't have to wear masks at hotels. And of course, a lot of that is self-serving, right? Because they want people to come back to travel again and to stay in hotels. But I ask, with less than half of our country now fully vaccinated, do we run the risk when we open up to such a large extent so quickly? Do we run the risk of another big second wave? I mean, we're seeing what's happening right now in India, which is an atrocity. Could we possibly see something like that happen here again?
The short answer is yes, absolutely. There is that risk. There is that risk because we don't know what mutants tomorrow will bring. There are new mutations happening in India, Nepal, Brazil, even right here in the U.S. That's possible. So there is that risk, and there will always be that risk until everyone around the world is fully protected from COVID. And so that is true, and we definitely have to recognize that that risk is there. I think that what the CDC is trying to balance is that perceived risk, how big that risk is, right, against, what is the motivator for getting more people vaccinated. If they think, okay, now if you get vaccinated, you can take your mask off, maybe that would push more people to get vaccinated. Maybe that was part of the logic. Maybe part of the logic is to say, look, every day that goes by, we're seeing immunizations go up. Supply chains are getting a little bit stronger each day, not weaker. And so all those things mean that day by day by day, this decision looks more and more like the right one. And so that's probably all taken into account, but I don't want to downplay the risk you just said. It's a real risk, and we have to recognize that could happen here.
However, can we say, doctor, that we are officially on a path where the pandemic has really started to move to the rearview mirror? And just more broadly, Alexis was just mentioning India, which has really been struggling. I know that the United States has now made efforts to donate vaccines, but what really needs to happen to ensure that at least globally, we are all on that same track together of putting the pandemic behind us?
Yeah, it's a good question. I follow India closely. My background is I'm Indian, and I have family and friends that have been affected in India from this pandemic. And so even in India, the number of cases, the case counts each day in the last couple of days have gone down versus a week ago. That's good news for India. Many other countries are seeing that the case counts are slightly better. That by no means that we're out of the woods in India. There is much more need for vaccine. That's the biggest thing. They just need domestic production of vaccine to go up. They need more donations to come in from America, Russia, and other places, Europe, to get to India, so more and more people get vaccinated. They have a population that is much larger than ours, and so the need for vaccine is much larger. And that is what's going to solve this issue, is once we get more and more people vaccinated there. So that's clearly the next step, is to get more and more global entities involved, like WHO and PAHO, to get more money to get the vaccines that they need there.
All right, Dr. Rishi Desai, Chief Medical Officer at Osmosis, former Epidemic Intelligence Officer at the CDC. Thank you so much, as always, for bringing us your insight.